The question that is guiding this discussion is, what must holistic health practitioners be fluent in for integrative care to meet academic and clinical standards? This is a faculty dialogue on professional formation in integrative health. It's not a philosophical debate. It's truly an educational inquiry. As you listen, consider where your own training has supported or maybe not supported that level of fluency. I'm going to take the slides off, and we're going to open up the table for the faculty to start sharing in an open roundtable discussion. Let's first name how we're holding this conversation. We want to let you see how we think together as faculty, because that's how students learn inside this program. So rather than having each faculty member speak about their field, we're going to sit inside a shared inquiry together. Because the reality is this: the challenges people are bringing into holistic health spaces today are not disciplinary, they're psychological. Psychological, relational, cultural, and systemic, all at once. So the question guiding this roundtable is simple. What must the practitioner of the future be genuinely fluent in, not just trained in, to practice holistic health with integrity, effectiveness, and ethical responsibility? By fluency, we mean capacities that shape real-world decisions, not just knowledge or techniques. So as you listen, you may hear different languages, traditions, frameworks, but what we invite is for you to notice not just what is being named, but how these perspectives speak to one another, where they overlap, and where they reveal limits. This is how integrative intelligence actually works. It's the level of dialogue we believe higher education in holistic health now requires. So I'm asking each faculty to speak from lived practice and disciplinary depth, and we can go ahead and start. Who wants to go first? You can just unmute yourself or raise your hands. Shall we repeat the question again? What must holistic health practitioners be fluent in for integrative care to meet academic and clinical standards?
I can get started, Alicia, if you like.
Thanks, Kaley.
I've already been chatting so much already since day one. Everybody's heard me talking. So just to give a little bit of my background into that, because I think if we're talking about a real lived experience, we need to talk about how we got here. Why are we here, and what kind of intersections have we found in our practice? So currently, I practice as a functional medicine nutritional therapist. I probably practice more of nursing philosophy today than I ever did when I started my career as a nurse, as a registered nurse. And it's because there's this theory practice gap that exists in the allopathic system or conventional systems, I think in every system. And there's tools that are missing, not only from the actual action of healers, but there's tools that are missing in the education of those healers. So not only are we able to see in Bindu that we're getting a synergy of different types of practitioners, different methods of actually being a practitioner, but also learning how to be those different practitioners, or learning those different techniques, that from Ayurveda to Eastern medicine to allopathic to functional medicine to naturopathy, all of these different modalities brought together with someone that's actually able to think outside of the box is going to be the healer of tomorrow, the future healer. And the nice thing that we talked about in Bindu and that we experienced was that we're teaching from a different perspective. So we're offering you to dive deeper rather than just giving the information. So rather than just providing stats on a screen, we're actually inviting you to collaborate and compare and analyze the information. And when I did my master's thesis, it was on an educational theme of this very topic. So are the educational universities and these educational bodies, are they adapting to the changing landscape of education? Are we seeing things shift based on technology? We have all of the information in front of us for most things, but are we actually being taught how to utilize it and how to have an open mind for all of these different concepts? And this is where Bindu really became interesting to me, as we're also talking about not only healers, which is so interesting. After becoming a yoga teacher, I always wanted to bring in integrative medicine. I was always the nurse looking to educate clients and patients rather than just dole out medicine, even getting into trouble for doing it sometimes. But this is what I craved. This is what was important to me. And I didn't understand why it wasn't being integrated. Why aren't we utilizing all these different tools? And why are we not being taught to think openly about it in our education system? So when this came up, when Bindu came to me to help expand and teach and share the experience that I had, and obviously share the knowledge that we can bring to the table in each of our individual modalities, there was no question. I think the future of practitioners must be fluent in several different types of modalities, but be able to embody an open mind to decide and discern what is necessary for that client. So you might be a specialist in functional medicine, but a client in front of you might very well benefit from Ayurveda. And having the knowledge, that's what they need, and being able to maybe refer them to a fellow practitioner from Bindu is what we're really looking for. A collaborative approach that's holistic. I was taught this and studied it at a master's level in nursing about how nurses are holistic practitioners, but I never actually clinically practiced that way. So it's lovely to have a space where these sorts of dreams can come to fruition, and being able to provide exactly what is necessary for the academic and clinical standards that I think and I truly believe are necessary for the healer of tomorrow.
Thank you so much for your thoughts on that, Kaley. Yeah, it seems like you've really experienced firsthand the different spectrums of what we're talking about here. And I know that teaching is one of your passions. So it's really beautiful to see this come to fruition for you as well. Anyone else care to speak? Maybe Alexina or Kelsey?
I will.
Lucy, okay.
I just wanted to jump off on the back of what Kaley said that really reminded me of one of the kind of ancient teachings of like the map is not the territory. And I feel like so often in that, like the old versions of education, it was about like that rote learning, right? And being able to memorize it. And I even had this experience the other day. I rarely go to the doctor, but I went to the doctor and I had the experience of feeling like they were having a dialogue inside of their heads with the information they learned versus actually being in like an interactive dialogue with me. And I feel like from the background of coming from yoga and self-inquiry and philosophy and meditation, that's the whole purpose of all of these ancient wisdom traditions, is you embodied the wisdom. And that for each and every person, for each and every practitioner, student, person in front of you, it's going to be very unique. And our capacity, almost like Kaley was saying, is that I almost felt like as you were talking, it was like, we need like a both and situation. And that's where like I like come back to this idea of Tantra. So in Tantra, they have this beautiful idea of being able to embrace paradox. And it reminded me of the fact that actually I feel like we all need to have these specialization pathways like each and every one of us have. And at the same time, like Kaley was saying, we need to also have this like broad spectrum, holistic, integrative understanding. And so many of the modalities that each of us are bringing to this kind of discussion is exactly that. Like when we, whether it's like Chinese medicine or Ayurveda or yoga, so many of them are talking about like the multifaceted experience of being human, whether that's the physical element or the psychic element or the emotional element. And I feel like more and more the future practitioner needs to be so well versed inside of that. As Kaley was saying, we can be very responsive to who's coming to us and what in that specific moment, like what are the needs that are being called for, and to just keep coming back to embodiment, like the embodiment of this multifaceted, holistic, inside outside element, and then treating people from that place. And I think when you've come from that background of that's your personal practice, is that you're constantly in a ever-changing relationship with yourself as your physical, emotional, energetic system interacts. I think then we're able to meet our clients, our students, from that place of, yeah, the map not being the territory, and just coming over and over to that place of, yeah, the merging of the rivers, almost like all of the confluence rivers coming together into this ocean of amazing kind of full-bodied wisdom. So that was what I was vibing off the back of what Kaley said.
I love that. I love the map is not the terrain. It really speaks to everything that you guys are talking about, and that it's about embodied learning, and that takes not just wisdom and memorization, but actually experiencing things and working with mentors. And that's why I think the mentorship piece is such an integral part of the program as well. We'll get into that. Alexina, I see that you've unmuted yourself.
Yes, yes. So thank you, ladies. That sparked some thought for myself as well. So, one, I have three things to say. So, one, when I was doing my doctorate in naturopathic medicine, we were just getting pummeled with information. And when I started, I was 24 years old and did not really know myself as a human being at that point. I'd just been to university for the last 4 or 5 years, and now I was embarking on this program. And I just remembered when I was in the program thinking, I wish we had more time and space to actually work on ourselves. And you'd think that in a naturopathic medical degree that would happen, but it didn't happen. It was very limited, very, very limited. So many students got very burnt out and many dropped out. And I remember when I was halfway through the program, I said, "Oh, dear God, give me some hope here. Should I continue or should I just move to India and become a yoga teacher?" Because that actually was on my mind. I really felt like the program was far too medicalized, and really what I was looking for was something deeper. And then I asked that question to the universe really at the time, and I started meeting other people like me, but they weren't in my school. They weren't in my program. I started attending other conferences. I started meeting other practitioners. And then I started to meet naturopathic doctors that actually had a more, you'd think naturopathic medicine was holistic, but they had a more holistic approach in the sense that they really understood that there is something going on beyond the physical, beyond the emotional, into the soul and into the spirit. And that's really where my heart was. I felt that if I was going to be sitting with a patient in front of me, I would want to acknowledge their entire existence, not just their cellular health or, their anger or their frustration. I wanted to be able to know how to sit with someone and be present with them from a soul level. And once I started meeting all those people, I realized that there was a huge world out there. You can imagine at the age of 24, you don't have a lot of life experience. I didn't. And so once I started meeting all these people, I thought, wow, I want to be like that person. And then I met another person. I thought, oh, I really like how they have so much empathy, and I really like how they guide people in different ways on these different paths and bring them back to their body. And so that started an exploration for me where I began to study all these different modalities. And yes, it was a lot, but it allowed me to satisfy the need that I had inside, that there's so much more than what I was taught in my program. So that was the first thing I wanted to say. And then the second thing is that being married to a medical doctor who has a huge love for what I do and who I am, obviously, but when I met my husband, he was so disconnected from this side of his life. And I started to attend his medical conferences with him because he'd go during the day and then I'd go somewhere and we'd meet for dinner and we'd meet all of the other practitioners and doctors, specialists of all kinds. And I just remembered thinking that, oh my God, these people need help. Just, and I would talk to my husband after we'd go for dinner with them all. And I said, honey, these people need what I do. Like, we need to set up some type of a seminar or a workshop for them because they are literally cutting people's bodies open and they're bringing people back to life. But I could see that so many of them were really struggling themselves. And so he opened up to me and he said, honey, all the doctors I know, like 1% of them actually is like you. They actually take care of themselves. Most of them go drinking after work, most of them. And, he gave me the intel. And so after several years of attending more and more of events with him, I saw that there's a huge gap in getting medical education or healthcare education, and then a practitioner embodying what they're teaching. That's a whole other huge topic that I'm not going to get into, but that's something that comes to mind, that there's a massive gap. And there's a lot of work that can be done in that department, not just self-care for the practitioner, but what about knowing about nutrition? Most of the people that I was spending time with in his circles had no clue about nutrition. And when a lot of those patients were coming to see them, of course, they're not guiding people in the direction of nutrition. They're guiding people in the direction of pharmaceuticals and surgical interventions because that's what they're trained to do. And the third thing that I wanted to say is that a lot of the time when patients come to me, I open them up to a new way of seeing the world and a new way of seeing themselves. And a lot of the time they look at me and they say, how come my doctor didn't tell me this? And you want to know what my answer is? I tell them, your doctor wasn't trained in any of these modalities that I just shared with you that can help you. Your doctor was trained in pharmaceuticals and surgical interventions and knowing how to refer out. And that's a good thing. It's a very good thing, but they weren't trained in vitamins, minerals, nutrition, comprehensive gut testing. They weren't trained in the energy body. They weren't trained in how to manage your emotions. So your doctor didn't tell you that because they weren't trained in it. So I can see those are just a few thoughts that come to mind. There's a huge gap, and there's going to be a lot of more education. I think what we're doing here is just the tip of the iceberg because there's so much more that can be done. So thanks for listening.
Wow. Thank you so much, Alexina. You touched on 3 really potent and relevant points that I think everybody resonates with from personal perspectives, from professional perspectives as well. This is one of the reasons why we're starting this program, this master's program, and part of the potential master's candidates, students would be medical doctors who are looking not just for tools, a broader set of tools for their clients, but also for their own personal development. Because as you embark in the program, it is guaranteed that you will have an extensive amount of personal development work. I mean, I think most of us know from experience that every training that we've gone through, whether it's a yoga teacher training or a meditation or something, or even the smaller formulations, you dive into your own work when you're working with contemplative inquiry and pulling in these different modalities. Kelsey, I think you probably have a lot to share on this topic.
Yeah, what I'll add in here is that I feel what's coming up for me is just this idea of having so much information available to us. And it's kind of the time of information overload and accessibility to so much and from everywhere. And so I feel like for us as practitioners and trainers and the future practitioners to come, just the capacity to really sit in ourselves, as it has been discussed, and have our own sense of self-exploration and care and experience with our own holistic journey, to give us the capacity to really see through all of the noise. And so to be able to be really competent and fluent in showing up and being present, not just for our deepest learning, because with so many distractions, it's so easy to be in a learning situation and then be pulled out of it and have little actually settle. And so to be in a space that supports the presence and the mindful awareness to actually take in the information and to hold it deeply and then to express it outward. And also for our clients as well, to be present with them and to see their individuality. And what I really love about holistic wellness and working with my clients in Ayurveda is this capacity to zoom out and see the macro and how we're all part of nature, and how the rhythms of nature reflect in our own cycles and patterns and expressions of our health or our deviation from health. And then also to be able to have that zoom in. And I liked in Kaley's presentation the other day how she was using the words zoom in, and be able to zoom in and to see who is this person in space, where are they in all of these aspects of them, and to very clearly see that instead of going into a box, the memorization box. And so the idea of the educational models being less about memorization and more about that deepest understanding and that knowingness that comes from being present with it, which comes through our own practices. And then rather than having all the information that's available to us and available to the people we work with, rather than having it either fragment us or have us zero in and tunnel vision to, okay, I'm only going to focus on this, then I think it helps us to be able to explore what we come across through the lens of what we're trained with. And I think that's very expansive. And I have so many clients and students that I work with, and they say, well, what about this from this system? And I love thinking about it and saying, okay, well, let's look at that. Let's put it on the page here and look at that and see how it applies. And I 100% have referred people to different modalities. And I have someone I'm working with right now, and body work would be amazing for that person, but the access that they have in Hawaii it's non-existent for the type of Ayurvedic body work that I would recommend. And so recommending them to get acupuncture, and just how everything is so connected and supportive, I think is an important piece. And the fact that Bindu Institute trains the student right from the beginning in the multidisciplinary approach, I think is really valuable, because there's just that more free flow of information and the curiosity of human beings. We're curious and we get pulled one way to the next. So to be able to utilize that to our advantage rather than to our detriment and our fragmentation of our own practices, but also the paths of our clients and students.
Thank you so much for sharing that, Kelsey. One thing that came up to me when you were speaking as well, I think for the practitioners, in order to be able to have the capacity to be zooming out and zooming in and really being present with the people who are in front of them, is the state of their nervous system and how regulated they are. And that also speaks to Alexina's experience of being with all these medical doctors who are just after work going to drink, and they're not able to regulate themselves because of the way that the system is set up in many countries. I heard a stat recently that the average patient gets 7 minutes of FaceTime for a doctor's appointment, which is really mind-blowing. And then another stat that I saw is that over 50% of medical professionals are burning out post-COVID. And this is just not sustainable. In addition to that, we have a huge growing demand with the aging population, with mental health, with chronic illness on the rise. It's really becoming imperative that practitioners have the tools to be able to regulate themselves and then really be able to step into that space for their patients. And I see Suzanne has joined us, and she can probably speak a lot about this topic around nervous system and regulation. Suzanne works a lot around this with psychology and somatics.
Yeah, if we want to speak about nervous system regulation, I was just stuck underground for 2 hours on a train where I couldn't leave it. And I really didn't have much access to dial in. I could message back and forth with Alicia. And as I was going through that, I was going through my regulation tools and being able to sense into my system. And I feel like it's taken me like 35 years to develop this kind of relationship with my nervous system, to be honest, where I can have this one-on-one intimate connection with my nervous system and being able to dance with it now, where it responds to me very quickly. But it's taken me a really long time. And I feel like if I would have had that kind of experience right out of my PhD, I was working in a neuropsychiatric institute, like residential, with addictions and very heavy mental health disorders. And I was walking around very dysregulated because no one really had given me the quite of tools. And I was thinking, wow, if I had the tools at that time to really learn how to make my nervous system very resilient and agile, the way I feel like it's much more agile now, that, God, I think I really could have helped those patients in a very different way back then. I do think co-regulation is one of the biggest, most responsive tools for health and well-being. Hence why I'm with Alicia all the time. I'm always co-regulating off her. And I think we as human beings are always trying to co-regulate, to really find that space where we can be relational with others. It's when we're regulated where creativity comes, where intuition comes, where we're able to channel, and all of our knowledge from our long-term memory comes up into our cognition, and then we can make all these connections, and we can pull from all of our disciplines and then feel into our client and then feel into ourself, and everything come together. We can form a diagnostic, or we can form a treatment protocol. But that can't really take place until we as humans and we as practitioners have a nervous system that's regulated, until our consciousness feels expanded. And I think, just to align with what all of you amazing faculties are saying, we really need to have this embodiment where our extended years of practice have invited our inner body to be safe and our inner body to feel held, so that we can be these practitioners that allow the disciplines to form and create a framework that's multi-connected, So I think that's one of my first recommendations, is that the practitioner really has a nervous system that knows how to become regulated, that it's already gone through many trials and errors of using tools. And as your nervous system, it's like a muscle. It's like, as your nervous system is trained to regulate, it remembers, and it can be much more agile. So that's one of my recommendations, is that, or I really feel like these practitioners nowadays need to really have that intimacy with their nervous system. We do have a team that is versed quite a bit in the clinical realm. And I do feel like it's important to note that when we look at some of these wisdom holders from these indigenous cultures, these medicine holders, I've spent a lot of time in Tibetan medicine and other medicines that are from the indigenous cultures. And these people are deeply in touch with the land and deeply in touch with nature. And through this experience of being in touch with nature and in touch with land and in touch with the elements, they can feel, because that's universal. So then it makes that connection with themselves, and it makes the connection with ecology, and then therefore they can speak to the biology of their clients. So I also feel like that's one unique piece of Bindu, that we will be encouraging practitioners to connect with the elements within themselves and around them, and to utilize that as a platform for healing. In Harvard's medical school, it's been the longest longitudinal health study ever done. I think it started in the 70s, where they were collecting data. It's data on hundreds of thousands of people from every age you can imagine, and longitudinally followed them all the way until death and dying. What this study has found in regards to longevity and well-being and health is that the number one determinant of all of those outcomes is relations. So that it's someone's relation with others is how we invite health and well-being. I feel that the practitioners themselves need to have a very strong relational skill set so that they understand all the components of that, from the polyvagal system to reading nonverbal cues to understanding how to really connect on a very nonverbal way. Although also on the verbal, in Bindu, that's going to be a very big piece of the training for practitioners, is understanding what it means to relate to others in its various forms, from verbal to nonverbal, to intuitive, to psychic, to energetic, to the physical. So I feel that's also going to be quite a unique aspect of Bindu. And I think that's it for now. Very lovely to be here with you that are visiting, whether it's live or on the recorded follow-up. And it is really, I have to say, what an honor to be working with this amazing faculty and founders. The future is collaborative, as Kaley mentioned. We are not meant to walk this path of humanity alone. And people that try to do that, like that's the one thing we need to also tell our clients is, like, where's your support? It's the number one piece for you to get well. So where's your community? And we're a part of your community is something also I want to teach our practitioners, but for them to share with their clients. Let's form a community. And I feel like I love for our practitioners that graduate from Bindu to be like the wisdom leaders of community, because the community aspect is like a holder of well-being and health. And so, Alicia, maybe you want to talk a little bit about that community leadership piece, because that's also going to be a big component of Bindu.
Yeah, I think what you said, that we're not meant to walk this path alone, it's so spot on and so true. And I think this is one of the biggest diseases that we see in our collective society right now, is there's so much technological connection, but it's created a very community separation. And when we feel separate from each other, when we feel separate and disconnected from our systems, this is when a lot of disease can start to come up and manifest. And I feel like this connection, it's so important, not just on the personal level, but also when we're speaking about our training and our pedagogy and our systems approach, the systems thinking. It's all about connectivity and how everything is connected and how everything weaves together in this very cohesive way, that it's connecting all of the different tools from the different disciplines. It's connection. It's so key across so many different areas. And it brings me actually to the next question that we have, which I'm going to put it in the chat as well. So for those of you who are not faculty, you can also answer this. What capacity named today feels underdeveloped or unsupported in your current training or professional experience? So this can be something that the faculty can speak to, or from a personal level that you feel that you're not supported enough in or connected enough in, or maybe that's undeveloped that you want to dive into. So you're welcome to.
Hi.
Hi.
Even before talking about skills and capacities, I think it's important to go back to the idea of the vocation of the healer. The times of the shaman and the curandero, cacique. In India, we have Veds, who are the Ayurvedic healers, traditional healers as well. The idea that no doctor or psychologist is healing you in terms of your mind and your body. They're just helping you, your body, your mind, your soul to heal. And they hold the space gently, mindfully, through their presence, acknowledging your existence, as somebody pointed out before, like holding the space for you and teaching you as well, motivating you to heal yourself, because you're the one. A doctor cannot heal you if you are not willing to heal. They can give you the medicine, but they cannot force you to take it. They cannot force you to take care of your diet, to take care of your mind and soul as well, right? And I really like the idea that we have in yoga as well. Yoga, which is the union of body, mind, and soul, right? So, like, it's the whole integrative approach. You do not heal in isolation. No part of you can heal without the help of other parts. We are such a complex combination of the physical, the psychological, the social, the spiritual, and all these factors. They form us, and all our, like, at least the understanding that that is disappearing even in places like India today, that we are this, I forgot the word in English. I know the word conjunto in Spanish. This combination or this union of all these factors, and how, like, we can prepare ourselves to heal and give ourselves the time and space for this recovery, and how doctors and psychologists can also help us and guide us through this process, right? So that very idea of that integrative, not solution, but approach to healing, that's something that I feel that is disappearing, even from these communities, the indigenous. I've spent a lot of time in the Amazon rainforest with the indigenous communities as well. And having grown up in India, I've also seen that somehow Western medicine is now taking over there, and somehow we're losing some of the beauty of what used to work. I think this is a beautiful space now that we've reached, where we can talk about combining the two and how alternative approaches can complement the scientifically known and prone ones.
Thank you. Yeah, I think the concept of both and is really relevant here, that there is a lot of amazing developments in our modern science and medical and allopathic world. And we really rely on it in so many ways. And at the same time, that we can complement a lot of things. I have a friend who's undergoing ongoing cancer treatments, and she's also seeing an acupuncturist. So there's ways that we can integrate and combine modalities to really increase the quality of life of people that are under care, even in very difficult situations with potential chronic illness and disease. There's so much that we can do to increase the quality of life. And it really takes that holistic approach. Thank you. Okay. I see some other things in the notes: a clinical framework for integrative medicine, diagnostic and treatment protocols, which would allow modern medicine and traditional approaches to be integrated and used in cohesive model. Absolutely. Maybe not now, but in nursing school, there was an incredible lack of connection. It was almost encouraged to fail. Yeah, this like weeding out system, we also had that in engineering, where it was expected that a certain percentage of the people were failing. I think Alexina mentioned that as well in her naturopathic school. That was such a philosophy and clinical practice gap. I always thought to myself, why are we not teaching anything? Why are we not connecting to our patients? Why are we not providing them tools, multifaceted tools to succeed? Yeah, absolutely. This is the whole premise behind Bindu.